right.
All right, let's go ahead and kick it off. Welcome everyone to the Nebraska Civic Health Index 2020 findings. This is our public launch of the most recent and up-to-date Nebraska Civic Health Index, something that's been a long time in the making. So we're particularly thrilled that we're able to do this today, that we're able to share this with you today. So thanks for making this a worthwhile event. And showing and demonstrating an interest in civic health. That means a great deal to us. My name is Amanda Barker. I am the Deputy Executive Director and Director of Civic Health here at Civic Nebraska. I came on board shortly after we published the 2015 Civic Health Index, so this has long time been something that I've had my eye on doing. So I'll be presenting today along with my colleague, Daniel Bennett. Daniel is our Rural Civic Health Program Manager and was a major and driving force behind the creation of this index itself. So I'm particularly grateful to have Daniel's insight and talent on our team and to be able to do this with me today. Daniel, do you want to say hello?
Hi, everybody. Good to see some familiar faces. I'm based out in Scottsbluff, Nebraska, and work across the state. So, in fact, just got done working on doing some civic asset mapping virtually, which admittedly is not ideal, but we're still at it, working across the state. So feel free to reach out afterwards to collaborate in any way.
Absolutely. All right, let's go ahead and get started, dive in. A brief word about Civic Nebraska as an organization. Both Daniel and I and others on this call, I see Steve, Nancy, Jules, and more. We work to create a more modern and robust democracy for all Nebraskans. We've been at it since 2008 when our founder and executive director, Adam Warfeld, founded the organization really to think about voting rights as an entity and how we make accessible and fair elections. Very quickly, and I remember because I believe I was arguing with him in student government in undergrad, very quickly we pivoted to continue to expand our programming to include youth civic leadership or civic education initiatives, knowing that it was really important to give people the right information in order to make informed choices about kind of the public sector and democracy. So as you can see here, we have three main program areas where we complete our work. We have youth civic leadership, where we run after-school programs in Lincoln, Omaha, and Raymond Central School District, as well as providing educator resources and club programming as well. We also have our civic health programs, which you probably know a bit about if you're here. So that's the area in which Daniel and I work. We love the work we do, including some additional programming called Collective Impact Lincoln, which is building up 6 core neighborhoods in Lincoln, Nebraska. Nancy Petito can wave, she's in charge of that. As well as One Omaha, which is, again, a neighborhood-based entity for Omaha neighborhoods. And then, of course, rural civic health programs and beyond. And then finally, we have our voting rights initiatives, those flagship programs where we really work to protect a modern and accessible election system. We do that through some voter education work, get out the vote work. We did a big old census project last year. You may have heard about that. And then, of course, we have a policy portfolio within our voting rights team as well. So lots of great work. We love what we do. We have great people doing it, but more than that, we're excited to be able to talk about civic health and the Civic Health Index today. So it bears mentioning that the 2020 index is not the first time we've looked at this concept or this framework of civic health. In April of 2015, we published the first Nebraska Civic Health Index with our partners, the National Conference on Citizenship, that we joined roughly 25 other states who had published a similar index. This, of course, led to the creation of a whole program area that I just talked about, where we have 8 full-time staff working to advance civic health in communities across the state. It also led to the creation of programming, that Collective Impact Lincoln program I mentioned earlier, a rural civic health initiative that Daniel leads, and even some civil discourse and media literacy curriculum as well. So the index in 2015, all that is to say, really spurred a lot of great things, not only for us at Civic Nebraska, but from Nebraskans all over the state. We heard that it was a refreshing look at who we are as Nebraskans, even in a nonpartisan manner. We heard that the 2015 index fostered dialogues in classrooms, in boardrooms, and throughout communities in all corners of the state. And really, the index caused us at Civic Nebraska and beyond to look at the challenges of a democracy and community in an entirely new way. So it's done nothing but good things. So fast forward to 2020, and we wanted to produce a Civic Health Index once more. And we're excited to be able to share that with you today. We didn't do this in a vacuum. Obviously, we worked again with our national partners, the National Conference on Citizenship. We also had a ton of support and help from the Nebraska Public Policy Center, the Center for Public Affairs Research at UNO, and gracious support by the Whites Family Foundation and the Bryan Health Foundation. We also wanted to give a special thanks to our partners within the working group. We convened a working group to move this project forward. So that includes Janelle Walther from the PPC, Dr. Brandon Grimm from the UNMC College of Public Health, Kenya Love with UNMC's Center for Reducing Health Disparities, Don Mackey with Nebraska Extension, LJ McElravy with the Nebraska Extension and Rural Poll, Melina Rousseau with Iowa West Foundation, and David Druzin from the UNO Center for Public Affairs Research. Those people were incredibly helpful. So, and several of them may be on this call. So a special thank you to them. Let's dive in a little bit. First, starting with Civic Health 101. What is civic health? If it's a term that's new to you, that's perfectly fine. We threw the official definition up here, that you'll also find this in the index itself. And actually, let me go back. If you want to follow along with us, the Nebraska Civic Health Index from 2020 can be found at civicnebraska.org. We're going to drop that in the chat. So there's a digital interactive website that our amazing communications team has put together so you can see the data in a unique way. We have the PDF of the report up there if you simply want to hold it in your hands and read it. And then we also have some additional resources and material. So thanks, Daniel, for dropping that link in the chat. So civic health, there is our definition is there up on screen. You can see some key points of this is the degree to which individuals participate and are represented in their community. So some key factors. And then also how people organize to define and address the public issues that come before them. Civic health is kind of a complex topic. We know since we've been working in this field for several years, and yet you know it when you see it. You know a vibrant and active and connected community when you see it, and you know their civic health is strong. So we'll be able to begin kind of breaking that down bit by bit over the next hour and give you some data to understand how Nebraska does in reference to our civic health. So the civic health framework, as we often talk about it, includes 4 indicators or 4 pillars of civic health. Left to right, we have social connectedness. And that's the notion that if democracy is of the people, by the people, and for the people, then people are the base unit. We often talk that you can't have an understanding of the common good or the issues and opportunities that face your community if you aren't in fellowship with others. Then we also turn to confidence in institutions as well. And this really is premised upon the notion that your belief in democracy isn't dependent upon a single political actor. This again refers to when you believe that the system itself is upholding the common good, or that the institution is fair, responsive, and effective. A person's willingness to engage in their community is often predicated on that confidence in itself. So it's an important indicator. We also have community engagement, which are those regular and consistent actions that uphold communities. You know them, volunteering, attending public meetings, etc. And when we see that these activities are present, it indicates a strong ownership in community and collective care and collective problem solving, all things that indicate a healthy community. And then finally, we have political involvement. This refers to the ways that people influence government and institutions. That obviously includes voting, registering to vote, contacting public officials to share your opinion, discussing politics, and more. Oftentimes, these are the first and sometimes the only ways we measure democracy as we think of it. which is certainly not bad. It's one of 4 ways we can measure it, but certainly political involvement matters in the scheme of civic health. Daniel, you want to take this one?
Yeah, so why is civic health important? Everybody's going to find something a little bit different in civic health depending on their role in the community and their role professionally. As Amanda mentioned, effective self-government relies on civic knowledge and participation of the people to govern effectively. But we also know this people power is important to the decisions that shape economic opportunities and completing community development projects that improve quality of life. And so the ability to address these problems also helps our community respond to public health challenges. And we've seen the importance and the confidence in institutions plays in public health over the last year as well. Lastly, I'd like to mention that, I think most of us on this call are involved in the work that we're doing because to some extent we feel like it's important to do. And we feel that that these habits of engagement, that being involved and knowing your neighbors, helping shape your community is just an important part of your character. And so we want to see that passed on to the next generation. We want to see that important facet of sort of who are we becoming as a community and as a state. So that's important in that character aspect as well. So I'm going to move on to discuss methods, and if there are any questions, feel free to drop them in the chat, or and we'll try to respond to those. But there's a few sources that we drew from for this. So first of all, most of it comes from the current population survey from the US Census Bureau. And this is actually a part of the Bureau of Labor Statistics, which is the primary means of understanding monthly employment and earnings and education. So on the September 2017, as they were doing that survey, which is a phone survey, they did a supplement on volunteering and civic life. And so the answers to those questions is where we get a lot of this data. There was also in November of 2018, there was a follow-up similar survey from the current population survey right after the 2018 midterm election, similar sample size of 750. And I'll say about the CPS, it's a little bit underrepresentative of African-American and Hispanic populations, but it's pretty close. So it's pretty good data. And then and I think income is pretty representative as well. So in education as well. So that's a pretty good resource. And then we also filled in some of the gaps with the Nebraska Rural Poll in 2019 and 2017. So this is a mail survey. We're very fortunate to have some of the members of the Rural Poll in our working group and help us fill in some of the gaps. But yeah, so about 1,700, 1,900 respondents in those. And the info on this is that it's skews a little bit more white, higher income, higher education. So that's important to keep in mind, but we still think there are some important themes we can pull out of that as far as it goes for the rural parts of the state. And then lastly, we have the Civic Health Summit, which was in May 2020. We had about 80 attendees. And this was qualitative data and focus groups that the University of Nebraska Public Policy Center helped us analyze the transcripts of those conversations and pull out some common themes. So when you see the priorities in this presentation for each of these indicators, a lot of that information and how we landed on those priorities came from these conversations at that Civic Health Summit. So with that, we'll just dive into the data. I'll pass it back to Amanda.
Absolutely. Thanks, Daniel. Let's indeed go into deep into those 4 pillars or 4 key indicators of civic health. First, we have social connectedness. And as I mentioned just a few moments ago, social connectedness really includes the quality and the frequency of personal connections that a person has, as well as the notions of cohesion and trust within a community. We know that social connectedness is important just on an individual and personal level, because those relationships are the lifeblood of and companionship are the lifeblood of basic human needs. But it also brings value and meaning to the places we live. It's certainly consideration when you think about where you want to live and thinking, well, who's there? Who could my friends or partners be? You'll hear this in our priorities section in a few slides, but communities really cannot afford for social connectedness to be an afterthought. Residents who are disconnected from each other are also disconnected from support networks, from collective problem-solving efforts, and even from like new job opportunities. So there's an economic impact as well. Understanding where and how people connect and working to expand those opportunities for people to connect is critical work for communities who are focused on their civic health. And you'll see that it won't happen by accident. So what does the data say? We are a national leader, at least in the notion of spending time with family and friends frequently and with neighbors as well. We rank 10th and 5th respectively, as you can see. So nearly 9 in 10 Nebraskans spend time with family and friends on a regular basis. But we do start to hit that middle or bottom half in terms of relative to the nation when it comes to spending time with people of different backgrounds, when it comes to doing favors for neighbors, or when it comes to providing help for friends and family. So the top of this chart tells a really positive story, and we should celebrate that, but there is certainly work to be done as well. When we drill into this notion of spending time with others from a different racial, ethnic, or cultural background from you, one thing we see is in the age difference. So younger people are far more likely in Nebraska to spend time with people from a different background. That's roughly 70% of people under the age of 25. You can see that reflected in the big purple dot. As age increases over here on the over the age of 75, that's only 15% of folks over the age of 75 indicated that they spend time with people of a different background than them. And then that orange dot, that not at all, I don't spend time with anybody from a different background than me, starts to grow. So younger people are really leading the way in this regard and in bridging those divides in terms of different backgrounds. The data really clearly highlights the need to target our work in this way. In order to tackle inequities in civic opportunities and overall civic health, this will be important to discuss in your communities and with your groups and organizations. When we look at the breakdown between metro versus non-metro, or we see that Nebraskans in metro areas or urban Nebraskans are more likely than rural Nebraskans to spend time with people from a different background, to the tune of 60% of urban Nebraskans as compared to 36% roughly of rural Nebraskans. So again, that could be an access issue, but at the very least, we see young people and urban Nebraskans leading the way in this regard. So we have some priorities. Again, these were pulled from the dialogue at the Civic Health Summit last May, and also from the data. First, we need to focus on the infrastructure of connections. Again, it doesn't happen by accident that people come together. These are the community events, associations, and places where people gather that are really a part of an infrastructure for building and sustaining that social connectedness. Community assets like events, associations, and places, they fill a vital function in community life because they provide opportunities for people to build trust, to initiate relationships that they maybe wouldn't otherwise have done. And also just basically understanding, having a kind of a landscape of where and how do people connect in your community, and then work to expand those places is really critical work for communities that are wanting to improve social connectedness. We also know that a connected community doesn't happen by chance, but through the intention and initiative of people in the community, right? So identifying and enabling those connectors and includers who have taken it upon themselves to create connections are critical to a healthy community. Those can be formal leaders, of course, but also informal community leaders as well. They don't have to have a leadership title or an elected position. And also thinking about how you connect different networks, and there are people bridging those connections. A final priority within social connectedness is bridging social connections across backgrounds. So as the data highlighted, we mentioned, it will be important to do that. And we found, again, in our conversation at the summit, is that it's not just going to be individual work, but also institutional and leaders that need to go beyond reinforcing just those close bonds of tight-knit communities, and instead also to like build those cross-cutting ties that bridge diverse groups. A strong focus on inclusion and equity in civic and community engagement are going to be very important for the long-term survival and well-being of any diverse community. So 3 key priorities there. Daniel, you might be muted. Maybe.
God, you would think that a year into this, but anyway, yeah. So moving on to confidence in institutions, and by the way, hold on to your questions. You can drop them in the chat, or we'll have some time at the end too. So keep the questions percolating. But confidence in institutions, you know, we know that a person's willingness to engage with an institution is largely predicated on their confidence that that institution is going to be responsive and can be trusted to do the right thing. So when we're talking about constant confidence in institutions, the institutions that we're talking about is everything, you know, locally from your city council, your hospital, your local schools, and then as we move up the state level to, you know, the legislature, the criminal justice system, and then all the way up to our federal institutions like Congress, Supreme Court. So taking a look at the specifics of this, the CPS data didn't ask questions about confidence in institutions in 2017. So to make sure we included it in the conversation, we drew on the June 2020 Gallup polls. They've been doing a confidence in institutions question for a long time. And this time around in 2020, you can see small business, the military, and the medical system were the top 3 institutions with the highest confidence, and then big business, television, news, Congress, the lowest. It's notable there was a double-digit increase in medical system and public schools, potentially as a response to COVID, and those institutions are picking up a lot of the burden in making sure our communities are able still to function and picking up those roles. And then also wanted to, in the next slide, I just wanted to mention too that confidence in institution can vary depending on what group it is and depending on race. So here Gallup looked at the confidence in the police. So this is across the nation, and just shows that, you know, white adults have just under 60% high confidence in the police compared to 19% for Black adults. So I mean, that's a huge difference in perception of whether you can trust that institution. And it's going to be different by community. It's going to be different by state. But I think the point we want to make here is that, you know, even locally, just because an institution might have high confidence among even a majority of people, there might be some people in your community where there's not that confidence as well. So being aware of that and being aware of the reasons for why that is important. We also are grateful to our rural poll folks. We'll probably be doing a couple of webinars together down the road to share some of this data and how it ties into civic health. But there's a confidence in institutions from the rural poll in 2017 as well. So at least in non-metro areas of the state, public safety, public schools, and voting and election systems in your county rated the highest confidence. And this was in 2017, so maybe things have changed since then. But we did want to mention a couple trends that we think will hold true still. And one important one is that you can see, you know, sort of as you go from local to national, confidence goes from higher trust in local institutions to less confidence in those federal institutions. So, you know, this is bringing to mind, how can we really dig into our local institutions as conduits for progress in solving local issues? As far as trust in information sources, this is also from the rural poll in 2017. You'll see the same sort of gradient, I guess, from local to national sources of information. So local TV and news and newspapers to, you know, those networks, ABC, CBS, Fox News. And then also the internet-based sources towards the bottom of the confidence as well. The other thing I just wanted to point out that's interesting in this is, you know, family, friends, and acquaintances. the third most confidence in as far as where we get our information from in rural Nebraska. And that really, I think, underscores the importance of the conversations that we're having, how we're talking about the current events, and makes a case for that civil discourse and, and basic shared understanding of facts as well. So, so that's an issue I wanted to highlight. So as for the priorities, number one that was mentioned in that we talked about in some of those focus groups, and that we think the data suggests, is leveraging high confidence in local institutions. That these institutions can be a conduit for progress on public problems. Not getting too obsessed with the national drama, but encouraging our residents to dig into their local institutions, maybe run for a local office, turn out in local elections, and also I think it brings to mind, how can we use those local institutions that have high public confidence to disseminate information, to make invites to be a part of a local planning process, things like public safety, potentially, volunteer fire department in a rural area. Secondly, addressing underlying causes of low public confidence in institutions by race and by geography was important. Summit attendees emphasized the importance of institutional leaders listening to constituents, especially groups which may have a history of mistrusting that institution. So finding out what are the underlying causes of that mistrust, and not just trying to smother it with more outreach, but can we address those underlying causes for mistrust? And then lastly, if the press is such an important part to freedom of the press, confidence in the shared facts is important to our democracy, then media literacy, journalistic integrity, support for those local media sources where we have high confidence, those are also going to be important going forward.
Thanks, Daniel. Great overview. Moving on to community engagement. These are those indicators that include volunteering, charitable giving, working with neighbors, etc. Again, when we see the presence of these sorts of daily and strong activities, it indicates an ownership within a community. And it's, again, suggests the collective care and problem solving approach that often will set a community apart in terms of its vibrancy. Through community engagement, it's not just all positive on the back end, but through community engagement, residents get to know their community and their community needs. They get to be connected with others, they get to share their gifts, and to really pursue common interests alongside others. So there's a lot of, again, first order good things that come from community engagement, but also second order good things that come from it, including social connectedness. When we look at the data, again, there's lots of pretty green arrows on this slide, so we're pleased about that. Nebraskans tend to do well in relative to the nation in community engagement. Nearly all of these metrics here increased from 2013, the last time we had this data available, with the notable exception of group membership there in the bottom, which declined across the nation and has been well documented by Robert Putnam and other folks. So again, we can feel proud and celebrate our high rates of volunteering and working with neighbors towards something positive. You can see that Nebraskans also contribute or charitably. Nearly 6 in 10 Nebraskans do that, which puts us just outside of the top 10, which means that they're advancing causes both with their time through volunteering and with their treasure. Two good things to be able to do to keep a community vibrant. When we break that down a little bit more further by age group, we see that the 65 plus crowd over here on the right-hand side are the most active in volunteering, while the 35 to 54 age range were most likely to work with neighbors to do something positive, yet they still had strong rates of volunteering and public meeting attendance. It's not seen in this particular graph, but the 35 to 54-year-old range were also the most likely for charitable giving as well, perhaps suggesting that some peak community engagement years are from, in Nebraska anyway, from 35 to that 54 range. Some good insight at the very least. When we break down community engagement by educational attainment, and I know there are a lot of educators on this call today, we see that higher education levels also tend to correlate to more activity in civic engagement in this pillar. Not entirely surprising to those of us who have paid attention to how that relationship transpires. However, it's worth noting that more respondents with a high school diploma, no college, responded that they got together with others to do something positive for the community than say volunteering. And we found that this may indicate that people without college degrees are still doing, are still acting in a community engagement fashion, right? But they're perhaps less tied to the more formal means of engagement, something with a structure like a volunteer program or public meetings or even group membership. Instead, this graph suggests the importance of engaging all educational levels in one's community, but making sure that those engagement opportunities can be accessible and not downplaying any informal types of community engagement. So certainly something to kind of chew on as we think about our next steps. When we think about priorities, again, what we pulled from both the data and the summit conversation, this isn't going to be a surprise to you. First and foremost, we need to engage everyone. It's not, again, civic and community engagement isn't just those formal associations or organized volunteering, but also in that the gifts and talents that people share with neighbors and family, or informal groups where people to get together that maybe they don't have a charter, but they have a strong purpose. And with formal opportunities too, how do we make sure that no matter your education level or your income, participation in those opportunities are accessible? We often look to the practice of asset-based community development, which challenge and brings community leaders to acknowledge and value all types of engagement, which means identifying and naming those assets as vital to contributing to civic life. In asset-based community development, then increasing community engagement isn't so much about enrolling new participants or adding to your group role, but instead it's maybe just taking initiative to connect diverse interests or people or skill sets to build kind of that informal network in your communities. Summit attendees also noted that much of the work of expanding engagement to more people falls within the realm of communication, right? And can we improve engagement in our communities if we think beyond just the traditional outreach tactics and instead, thinking about how things like decision-making are communicated in our communities, how conflict management within communities helps or hurts people communicating and engaging. So something to think about too is how does your community communicate with one another and engage people? Secondly, and this should come as no surprise to any of us who have lived through 2020, but adapting to new forms of engagement is going to be critical as well. And we know that partially from the societal standpoint, but also technological too. So examples here could include the Nebraska legislature has created an online comment portal, which is the first time we've seen that. So that's an institution that's being responsive from a technological standpoint to new forms of engagement. And we hope that that doesn't go away once pandemic recedes. But also just, again, those societal or community-led changes as well and engagement. And I think a great example here, the Grand Island Rotary, or one of the Rotary clubs, met regularly at noon for a long, long time when they realized that there were certain professions or whole categories of community members that weren't able to come at noon on a certain day, including teachers, because they can't step out to go to a meeting at noon. So they shifted their meeting time to be a little bit more inclusive, to be a 4:30 PM frame, or excuse me, meeting, which really hits on that societal changes, right? It's just a key decision and intention that, again, brings more people into the fold. So when we look at community engagement, those are some key priorities for further action. You are muted, Daniel. There you go.
So yeah, political involvement includes both direct action in the political process, like voting, contacting public officials, but also includes actions like political discourse, consuming news, and discussing politics. And so we'll take a look at some of this data here. So taking a look at this, you'll see that there's some significant differences between the CPS data shown and some of the Secretary of State data that we'll look at later as far as the voting in 2018. So we'll hit some of that Secretary of State data later, but on the overview, you'll see that a lot of these indicators in political involvement are up. So attending public meetings, discussing politics with friends and family, for example. In the one area in political involvement where Nebraskans outperform the nation is in voting in local elections, and pretty significantly. So that's good. And then, but you'll see that we are a little bit more middle of the pack, a little bit more mixed bag as it relates to some of the areas of discourse, consuming news, talking with friends and family about politics and local issues. So here's a map of the 2018 voter turnout, and this is from our partners at the Center for Public Affairs Research. So thanks to them for this information. And you can see the green counties here, that's where there's less than 45% voter turnout in those 2018 midterm elections. And the lavender counties are where there was over 60% voter turnout in the 2018 election. I don't have a snazzy updated map for the 2020 election yet. But I can tell you that I was just looking at some of the data recently, and in 2016 there was 7 counties with over 80% voter turnout, and in 2020 there were 40 counties with over 80% voter turnout. So things definitely are moving in the direction of more participation. And I think statewide it was about 5%, 5% increase. Another thing we wanted to highlight was just, where is there low turnout? How does this look, as you zoom in a little bit further? And it tends to correlate with areas that are lower income, higher density of minority population. It tends to correspond with lower turnout. Whether you're in Douglas or Sarpy County, as this image shows, or even in my home county of Scottsbluff. And so you can see those green areas shaded are less than 55% turnout for the 2016 election compared to over 70% turnout for the areas that are shaded dark blue as well. So important trend to keep in mind. Across age groups from the 2014 to 2018, this is CPAR data again, there's an increase among all age groups, especially in younger age groups. So that's a really great thing to see. However, still, the 26% turnout among eligible voters under 29 versus 73% over 65. So still a little bit of lag in the younger generations. As far as political discourse goes, we can see here that people are more often to have these conversations with friends and family than among neighbors. Considerable portion of respondents said that they didn't talk with politics with neighbors at all. And also, I'll just mention, some of the same trends that we see in the community engagement of there being less involvement in an indicator with a lower level of educational attainment tends to hold true for this as well, with 25% of high school grads discussing politics frequently versus 50% of college grads discussing politics frequently. This slide is some new data that we wanted to include, and it's on competitive races. So races where there's more people running for a seat than seats available, whether that's 2 people for 1 seat available or 3 people for 2 seats available on a school board or something like that. So you can see some of the higher offices have almost 100% competitive races from 2000 to 2020. And depending on the office, it can be a little bit lower across some of those state institutions. And then especially once you start getting down to the local level, like community colleges, there's a lot of races that are going with unopposed. And nothing against the NRDs. There were just a lot of them, so I didn't get around to entering all of that data. But I think similar stories to the community colleges. But this is something we wanted to highlight because there's that local leadership is really important, and focusing some of that political energy on the local level as well. And that's something to think about of, how might we encourage more people to run for those local offices, create a climate in our local communities where people are willing to do so. So some of the priorities that we've dug into and that were mentioned at the Civic Health Summit, the first one was, that we heard very clearly, was civic education, particularly for school-age children. So improving the knowledge and awareness about our political systems, which includes, state and local government, courts, legal systems, our Constitution, international institutions. There's a strong agreement that this starts early and that experiential learning opportunities are critically important for our youth to be able to navigate these institutions and be able to understand how they can participate, even before they leave high school. Secondly, practicing skills of discourse and media literacy. So fact finding and media literacy are important to being informed about interpreting current events. And also there's an urgency to teach skills of constructive discourse, which includes being confident to make and defend sound judgments about events, decisions, and ideas. Third, there's greater accessibility to participation. So finding ways to securely and effectively make participation easier for underrepresented and vulnerable populations to ensure that our democracy is truly representative. Recent example of this would be Secretary of State sending out the request application to vote by mail to everybody for the primary and general election. Just making that simple change reduced potential barrier to election day participation, and in the process we shattered turnout records. And then lastly is that there's a place for advocacy in this as well. Finding ways to elevate underrepresented voices in the political process, do it respectfully. So whether that's people who can't get all the way into Lincoln to testify at a committee hearing, or whether that's in Omaha or Lincoln, people who maybe aren't able to make it to that city council meeting or unfamiliar with the process. How do we gather those stories and help ensure that those voices are heard?
Great. As we look to kind of wrap up and take maybe some questions and discussion thoughts from you all, one thing we wanted to focus on as we wrapped up just this deep dive into the data is that although the data is statewide and obviously nationwide in some cases, most activities that build community and strong civic health start at the local level and even the interpersonal level amongst friends and neighbors. So when you absorb this information and think, what can I do? A really easy answer based on information and of course experience is start local. We'll talk about this in a few slides, but there's certainly also some support, statewide support and peer learning that can happen as well. And even aligning resources from organizations and institutions. So if you're a part of an organization or institution that is touching on some of these components, by all means think about how we can align that for greater impact. But really all of these actions, we want to really build communities where Nebraskans of all ages and backgrounds take action in their civic life in meaningful and innovative ways. So if nothing else, know that that's what we're aiming for today and in the future. Daniel, do you want to take the questions and discussion?
Sure. I think we've maybe had a few comments, questions here. One is from Tom Bliss. He says, have you noticed any school districts offering requiring civics courses? Seems so much is focused on high school entrepreneurship courses and sports at the expense of this. He's writing from a very non-athletic or innovative person's perspective. I don't know if that's true, but yeah, I think I guess I'm not the best person to speak on school districts requiring civics courses. Is there anybody on the call who would thinks they can field that question? Okay. Well, I do know that there's interest, in providing those experiential learning opportunities across the state, and several schools that do require those civics courses as well. Oh, Ebony wanted the question repeated. It was, yeah, have you noticed school districts offering requiring civics courses? That there's maybe more opportunity in the realms of entrepreneurship, sports at the expense of civics.
My question, we have a city council opening. We talk about encouragement, and we lack that encouragement in Hall County. And I hope with this meeting, we move forward with that, because a lot of Latino people, we make the 51% majority, and we have no city council representation. And we talk about encouragement. There's some encouragement. Where's the encouragement on that? If the time is now. We had a really clear voting effort, and it seems like we went somewhat a little bit independent in Hall County. If you were to push our buttons and tap on the Latino power, I think its community would be represented better. So let me know what you guys think about that, and answer my question. What do you want to do for encouragement in the Hall County, Grand Island?
Yeah, that's a great point. Yeah, I think, even locally here, been thinking about, well, what are the reasons that somebody might not run for office? I think that encouragement from across the community, and then, I guess I would also be curious, internally. It seems like a lot of people tend to run for office because they've been asked to, and that they have that local encouragement among their networks. Yeah, I've had a couple of questions about the pandemic and how that maybe affected response. Most of this data is coming from prior to the pandemic. So yeah, I would assume that the pandemic probably has affected some of the indicators that we would see here, and what people's responses would be of whether they've done these activities in the past year or not. And then Kristen has said, can you talk about how internet and technology can be a civic advocacy tool to help our communities improve their civic participation? Yeah, that's, I guess I'd open that up also to people on the call. Has anybody had experiences with that, locally, of internet technology being a civic advocacy tool?
Well, as of now, here I am advocating for Latino and encourage for Latino community. Of course, that is not my main goal, but here we are, and it has been very hard to engage the Latino community. Again, it comes to social and education programs to educate the Latino people. So in its effort, it is a good step, but it's hard at the same time trying to engage all the Latino community or everybody within that set group to come together. But it is a very effective tool if it's used right.
Yeah, thanks, Guillermo. I know our voting rights team as well has found a lot of success in the online space, and I think the kind of forced push to move online has expanded. For those who are able to have the time when the events are happening and have the internet access. Those options to participate virtually, whether it's at a city council meeting or testifying in Lincoln, have been opened up and accelerated. Rhonda, I hear you had your hand up.
Yeah, thanks. I'm in McCook, and since we have people from across the state, I just have a question, and it relates back to the technology. Our city council. Transparency is maybe not their best attribute. And so this past summer, they did include Zoom calls or, you know, they did do the city council Zoom, but has now taken that off the table again because they cite legal reasons. And so I'm just curious, you know, that's one way I just feel that more people could get involved, because fitting all those people, I mean, whether it's COVID or not, fitting that many people in a room that should be there listening, or just accessibility for those people that cannot physically make it to a city council meeting. So I'm just curious, you know, very specifically in other towns, you know, if they are broadcasting their calls and how they do that. So.
Yeah, that's a good thing to explore. And there may well be actual legal, you know, issues. I know, at least as far as the representatives of a political body, like zooming into a meeting, for example, in the Open Meetings Act, there was a limit previously on like 50% of your meetings a year couldn't be, more than 50% couldn't be virtual. And so there may be some legal hurdles to that. But yeah, as far as, you know, letting your citizens zoom in, yeah, maybe there are some examples from across the state. Anybody like to share?
Not to put her on the spot, but Nancy, could you share where the Lincoln City Council is at on that? I know that's one such example that we've paid attention to.
Sorry, I had to step away, so I don't actually know the question.
Sorry, no, I don't mean to put you on the spot. The question is, are there examples throughout the state of city councils who are either broadcasting their meetings online or receiving interaction between citizens or residents and city council? And what does that look like? What are some great ideas in terms of engaging people utilizing technology platforms?
Sure. I guess I don't know statewide what's happening, but here in Lincoln, there has been opportunity for virtual testimony. And it's gone back and forth. I think Daniel, I caught the tail end of his comment about, you know, the state policy about how much can be done virtually. And there's issues about how many council members are in the room to meet a quorum and those kinds of things. And so there have been some hurdles, but within Collective Impact Lincoln, we have been advocating for more options for virtual testimony during and after, beyond the pandemic. So when things do start to open back up, we have seen that the ability for folks to join virtually has made a huge difference, and more people are able to, I mean, it's difficult to always show up in person at a 3 o'clock council meeting or even a 5 o'clock council meeting, and to stay there sometimes for a very long time if there are going to be some highly contested agenda items. So that's something that we have been advocating for and working with the council on implementing on a more permanent status. There are a lot of things that you have to consider with staff time, some of the cost of having the virtual testimony, and making sure that it's easy enough to navigate during the council meetings. But that is something that we've been looking into and working with some other groups to try and institute on a more permanent level.
Great, thanks, Nancy. Well, I think we're running out of time here, so we'll close out and I'll pass it back to Amanda just as to touch a little bit on how we're going to continue this conversation and how we can all collaborate together in moving some of these priorities forward.
Absolutely. Thanks, Daniel. And thanks for your questions and additions. Civic health is certainly not something we own. And so knowing that there are people who are looking at community well-being from these facets and perspectives is certainly gratifying to hear. So if you are thinking, again, what's next? What can we do? How can we continue this conversation? Know that at Civic Nebraska, we're planning on a series of monthly webinars over the course of 2021 here, focused and again, centered on those pillars of civic health. So the first one will be focused on social connectedness, and we're hosting that on February 23rd. So stay tuned for more details about the time and place of that. Place will be Zoom. But we're hoping to highlight obviously communities and individuals and groups who do civic health well. So it won't just be Daniel and I talking throughout the year, but in fact, we'll be highlighting, again, you know it when you see it, civic health. We're also hoping to do some supplemental reports, especially surrounding the 2020 election data. There's lots of lessons to be learned from that. potential collaboration, obviously with the Nebraska Rural Poll and other survey groups and data groups. So stay tuned for perhaps some supplemental reports. We've developed a community self-assessment and discussion guide. That's on the website that we shared earlier at civicnebraska.org. You can find that right alongside the PDF of this report. So Daniel and I are happy to be a partner with you as you audit kind of the civic health of your own organization or community. Happy to help you think through or consider partners, resources, potential things to try. You know, Rhonda, if that comes to thinking about how the McCook City Council can utilize technology, we're happy to be a thought partner with you on that. We also have been hosting, shout out to Steve Smith, our communications director on this call, in Civic Seminarian. We've hosted a series of Civic Saturdays, which is just an hour and a half kind of service on a Saturday morning that really helps deepen fellowship surrounding these shared civic concepts. So it's not partisan in nature at all, but it's a neat way to connect over kind of our shared values of caring for our communities. Yeah, he dropped the link in there. I think the next one will be in March, so stay tuned for that. And then, of course, sign up for our thanks, March 27th. Sign up for our Civic Health newsletter, again, as we seek to align, again, that kind of peer learning network around the state. We would love to include you for the latest information and invite you to our kind of next conversation. So truly, civic health is something we all own together. We don't have that trademarked. And we invite you really to help us envision the future of civic health in Nebraska, whether that's in your community in Grand Island or McCook or Lincoln or beyond. We would love to align our work to support your vibrant communities with this framework. We're very much in a creative space as a civic health team currently. Of course, we've got programs and initiatives that we'll continue to carry forward with, but we also want to be responsive to the needs and opportunities throughout the state. So please reach out if you have ideas or questions. We would love to work with you in your communities. You can see our contact information there. But again, whether you're joining us live, thank you for spending some time listening to our presentation and understanding civic health more fully. And if you're watching this later, we appreciate you spending the time as well. So thanks again, all. Have a wonderful day.
Thanks, everyone.